Let's discuss left-sided heart failure, a condition in which the left ventricles fail to effectively pump blood to the body, leading to pulmonary congestion or fluid backing up in the lung, and reduced systemic perfusion. Here are the key concepts you should know about left-sided heart failure. The left ventricle is responsible for pumping oxygenated blood from the lungs to the rest of the body. When it becomes weak or stiff, blood backs up into the lungs, causing pulmonary edema or fluid in the lungs, and respiratory distress, difficulty breathing. The most common cause of left-sided heart failure is chronic hypertension or long-term high blood pressure, which increases the workload on the heart, eventually leading to the ventricular failure. Other causes include coronary artery disease, heart attacks, and valvular disease. Patients experiencing left-sided heart failure often present with shortness of breath, pulmonary edema or fluid in the lungs, coughing, orthopnea, difficulty breathing while laying flat, and fatigue due to poor oxygen delivery. In addition, they are likely to have hypertension or high blood pressure. As fluid builds up in the lungs, patients may develop rales, also called crackles. Rales are lung sounds that have a popping or crackling noise to them that indicate air is trying to move through fluid. In addition, the fluid in the lungs can lead to a productive cough. This productive cough can present with pink frothy sputum or a different color tinged frothy sputum such as yellow or white, and paroxysmal nocturnal dyspnea, or waking up gasping for air at night. A key diagnostic feature of left-sided heart failure is the pulmonary edema, or the fluid in the lungs. You can identify pulmonary edema by listening to lung sounds and hearing crackling or bubbling noises, which are referred to as rales and indicate pulmonary edema, or fluid in the lungs. Patients that present with pulmonary edema will benefit from the administration of a CPAP device, a continuous positive airway pressure device. This device will help push the fluid out of their lungs and back into the vasculature. Ultimately, this will help the patient breathe. In some cases, patients experiencing pulmonary edema will deteriorate rapidly. In this case, CPAP may be contraindicated. For example, if a patient is unable to control their airway because they're too sleepy or they've lost consciousness, then CPAP is no longer an option. Instead, you should ventilate the patient with a BVM. Other basic treatments include providing supportive care and transporting the patient to the hospital. ALS providers can also administer nitroglycerin and initiate further treatments such as RSI if appropriate. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.